clinical hours during the last 3 weeks, but since the 14th, which was my last clinical statement, I've approximately accumulated like 15 hours. I'm currently at like 70 hours, which isn't a lot, and I'm a little concerned. This is clinical statement number 2. Rose-Hulman's been a really great experience. I have nothing to complain about it for the most part. I guess in the last 10 days I haven't had a whole lot of interactions because this past week has been hectic since they have had their finals. I've learned a lot about the school in general. It's a little different than most as trimesters and stuff like that, and so their practice times are very odd, and I was curious kind of how it would affect the students and my patients, because some of them would have finals until like 12 at night, and practice, I think on Tuesday, was from like 10 to like midnight once, and that was really rough on some of them. I feel like overall Tristyn's been a great preceptor. I've learned a lot from her. They have a very nice kind of schedule that they go about, and they have like specific patients that come in and see them. They have a nice system in which the patients must make an appointment to come and see them, which keeps it kind of not as crowded in there as it is here at ISU. Basically for the last few days I've been doing like the same rehab process I have been, mostly ankle now because of one of our athletes went down with an ankle injury, so we've been doing swelling control. Right now we're doing a lot of strengthening and some balance, so some proprioception. She's been doing balance on a Interax pad, and that's been very helpful for her. We've seen a lot of improvement in her gait. Been doing a lot of gait training and trying to help her with her running so that she could actually participate in her games. Mostly been collaborating with, Tristyn and Scotty and Jared, our preceptors, as well as Eric and Jess, which are the other students along with me. I did get to see Amani, I think last week, during one of the games, which she used to go to ISU and is now one of the athletic trainers at Anderson, so it was nice to get to work with her and her fellow athletic trainer from Anderson that came for the game. I did get to talk to another athletic trainer from some other place, and it was pretty interesting getting to work with all of them. I guess the ways I measure myself as a clinician is I just kind of ask Tristyn how I've been doing, and yeah. But overall, I think my clinical site at Rose-Hulman's been going pretty well, and have no complaints.